you.
About home remedies,
electrolyzed water,
wheatgrass.
Okay, so first comes this home remedies. There are many oils here. One is used for leg pain, back pain and other things. The other one is used for some infections and other things. And this is volcanic ash. You can see volcanic ash is a powder. It is the remains of the volcano. In China,
eruptions and
yes.
Okay.
So what does it heal?
No, it's like a powder. We make it as a paste and apply over corns and calluses.
Okay.
So after a month or two, you can see the difference. See how
great
hard and
yes.
painful it was before. So after a month, you can see it has been totally vanished.
And so it can be used for a variety of skin conditions?
Yes, many.
Okay.
For some skin rashes and other
Actually,
things.
this
we use.
cold drops, I have
Yes.
used it and it is very
Very
effective.
yes.
Because instead of taking antihistamines
Yeah.
and
That
other
gives side effects
that
also.
give side
Side
effects,
effects. So
cold
that's
drops is very effective because I have used it and
likewise, we have
the
some
cold
cough
just
syrup
disappears.
everything.
Oma water.
Yeah,
Yes.
cough syrup
Our
is there.
grandmother
Our home of
used
water is
to
all our
Very
grandmother,
good.
it's all our
Grandmother
home
recipe.
therapy,
Yes,
which we
yes,
have,
yes.
which we should, use more often
More
instead of
often,
taking
instead of
medicines.
immediately going in for
yes, correct.
allopathic
Yes.
drugs.
So this is about electrolyzed water. We give it to patients who have recurrent UTIs, that is
Okay. Urinary.
urinary tract infections. Instead of taking, as ma'am said, so many drugs alternatively, it's very good. You can drink daily 2 liters a day. So
Okay.
after over 3 months or something, it's totally gone.
And the
gone.
beauty is
Yes,
all these
it will
home
not be
remedies
recurred also.
can be done in our house and
Yeah.
there are no side effects.
We give the water free also.
Okay.
So anybody can take
Oh,
here
that's nice.
for a day.
And
we
this
can,
Dr.
yeah, this is
Wheatgrass?
about wheatgrass. This is the doctor who has invented this,
Okay.
Dr. Chris Reynolds.
Ah.
He has treated over many patients in Australia. He has introduced this to us. So from him, we got this gel and other things. So we have used in many toe infections, ulcers, and other things. So you can see how
Diabetic
it's
foot,
diabetic foot
major
ulcers,
problem,
cellulitis,
right?
many things, burns.
Oh, okay.
Rashes,
Even burns it is
everything,
effective,
yes.
isn't it?
So you can see the pictures how it has improved.
Improved the
So how it was before, how it has come.
So there's
now it's
gel,
totally
spray
yes,
and cream.
cream. Yes.
Okay.
In 3 different forms it's
forms.
available.
Thank you so much.
This is the 7th pavilion. It's about metaphysics. That is, you can see it's epistemology and metaphysics in clinical medicine. We call it as
Dynamic acupuncture mediated metaphysical therapy.
It was named by Dr. CVK. So this is that is epistemology and metaphysics in clinical medicine. What is epistemology? And other introductions are there. It is done by Dr. Rajan Iyer. He has his own.
It is the dynamic acupuncture mediated metaphysical therapy, is otherwise called DAM. Then in metaphysical is all the physical bodies given through the energy.
Okay.
Then it is otherwise called the 3. In Tamil Nadu peoples are otherwise called Prana Shakti or Brahma Shakti. In Japanese is otherwise called He Shakti. Then in Korean peoples are otherwise called He. Then
It has various names.
Okay.
So
So there are examples in our
old epics.
in our epics and in our
it combines all alternative therapies.
okay. And these statistics.
It's statistics about last 2 years we have taken many patients, more than 500 to 600 patients, out of which we have given to several different categories,
Okay.
like diabetes mellitus, CAD, stroke, vertigo, cirrhosis, cardiac, everything, ENT, everything.
Every possible.
So many such cases we have given. So these are the statistics how in type 2 diabetes there are 22 patients we have taken, out of which 27% is very good and 68 is good, and fair improvement was about 5%. So likewise many such cases are there.
The important thing is there are no failures in this.
Yes.
Yes.
I think there is improvement
Improvement
in all
in
every day.
almost every
Improvement may be very good, good or encouraging to hear.
To see that our ancient
Yes.
Example case study of insulin sensitivity. In the first one is he was a 14 years boy. He was diagnosed type 1 DM. 3 weeks ago, he admitted in the blood sugar level 554. Then in diabetic ketoacidosis, increased the concentration of acetone level. Then Columbia Hospital. Then we will in this further care management in first visit. Symptoms of asymptomatic. On admission height 140, then weight 28.3 kg. He is a fairly good, but his HB level is a 9.4 gram. Is anemic level. Then C-peptide level is a 0.27 ng per ml. It is given to completed 5 therapy. Then he discharged in for prescription in human mixed insulin 30/70, 20 unit per pre-breakfast, then 10 unit pre-dinner. Then height same, then weight 28.4 kg. Then after he will weight is increased in 100 gram. Then he will come to second visit for symptoms is nil. Then boy is very
again
good.
the weight has
Again
is
the weight has
increased.
gone up again.
30.5.
peptide level also.
And he is symptom free.
Yeah.
Okay.
Yes.
Then HB level also increased to 12.2 gm.
Okay.
Then
So it means for every visit for DAM therapy, there has been
Improvement and he was no longer anemic. It was 12.2.
Then he will stop the insulin for before 1 month.
Okay.
He is very good. Then weight is 32.1 kg. Then
Oh, that's really
height also increased 142 centimeter. Is no symptomatic. Then as and telephonic follow up that patient in 10th
so this boy now is only doesn't need to come here.
Yeah, he will
From
call.
Bangalore.
No therapy is required. In spite of that, he is able to call from there and
Yeah,
report.
Report his findings.
Now he is 107 mg per dl in our blood sugar. In last 12th 11/2014 is taken in human mixture 30/70, 12 unit per pre-breakfast. That's why.
That's okay.
Miss, one lady is 74 years. She's gotten admitted in TAG-VHS. She's having acute severe abdominal pain and bleaching since admitted that morning also. But she's don't have any vomiting. In her AUDITORIUM abdomen, she's got acute pancreatitis. In a metaphysical, Mr. Rajan, Dr. Rajan Iyer is giving metaphysical therapy. His amylase and lipase level
Came
will
with
be
this much of amylase.
amylase
These
and
are the
lipase.
Normal range.
enzymes of pancreas.
After DAM therapy,
Which
this
was
level
very high
will be
when she
decreased
got
in the
admitted.
normal
Okay.
range.
Oh.
So after 5 days, you
After
can see
five-
how much it has reduced.
How much
After
of
5 days of
improvement?
therapy, she's getting
Yeah.
a normal amylase
And
and
also
lipase
this
level.
AUDITORIUM abdomen first
Features
noted
of acute
on 24th
pancreatitis.
during
Okay.
her admission. So on the 5th day, we were able to see the tabular column. 24th, it showed acute pancreatitis.
And
On 28, 4 days
features
later,
of
it showed regress.
pancreatitis
So,
have regressed.
so after a month,
After that,
we again
after
did
1/10/2013, MR
It
study
shows
of
no
pancreas shows
abnormality
no
at all.
abnormalities.
So she's
Absolutely all
absolutely
Yes,
she's all right.
definitely.
That's
Decrease
really
the
This
amazing.
is about the case of
DAM
pancreatitis,
therapy
acute
is-
pancreatitis.
Very fantastic.
DAM
So
therapy
it
is
helped
given
very
to
much in
100% level of the improvement of the patient.
Patients.
Feedback is very good.
Very good.
So
So
this
that's
is
normal
about
other
chronic
feedback.
pancreatitis case sheet.
Chronic.
Most of their back pain, leg pain,
Okay.
pain will be reduced. Then swelling also will be
Okay.
reduced in the therapy.
This case is about a chronic pancreatitis man. He was suffering for a long time. He's a diabetic, past history of diabetes. He was recurrently admitted in 2010. Every 2 months, 3 months once he will be admitted in corporate hospitals and taking treatment. So at that time, if you can see, his blood sugars will be very high. He needed insulin for control. So when we did my MRI abdomen in 2011, it showed mild acute pancreatitis. Okay,
bulky
and he was
pancreas.
again underwent some laparoscopy, cholecystectomy. But he was not free of complaints. He was again getting admitted now and then. So we have been taken advice by a leading gastroenterologist from our city who advised to do this gastrogifin meal and Bullida scan. So he was then came to Dr. CVK and wanted some suggestion to go for some alternative therapy, which he was sent to Dr. Rajan Iyer. So he had slowly he was taking daily. So then it went 3 days a week or something.
Lot of improvement.
Yes, he was able to be free of pain.
Okay.
His hunger improved.
Okay.
His appetite improved. So he became very well. Even now, once again he's coming and taking the therapy. So he's totally free of complaints. There was no admissions after that.
Oh, that is
So
really
till now
nice.
he's very active and energetic.
Very
We also
good.
gave some lectures about this. You can see our mail in the
Further
tag
feedback.
You can see there.
Very nice. That
He has
is
given
very
his
nice.
in writing also how he has improved, how his experience was with Dr. Rajan.
That is-
So that was a very good history about this chronic pancreatitis.
So now I think we can see Dr. Rajan Iyer.
இவங்கதான் ராஜன் சார். So
உங்க தெரப்பியை பத்தி ரொம்ப அருமையான ரிப்போர்ட்ஸ் கேள்விப்பட்டிருக்கோம். ஸோ ஒரு லைவ்
practical demo
டெமான்ஸ்ட்ரேஷன்.
கொடுப்பாரு.
This is without medicine.
Okay.
ஃபார் இந்த பேஷண்ட்டுக்கு வந்து லோ பிபி. நான் இப்போ வந்து பிபியை வந்து நார்மலைஸ் பண்ணி நியூட்ரலைஸ் பண்ணுறதுக்காக ட்ரை பண்ணுறேன். ஓகே ப்ளீஸ் செய்யலாம். சார் இவங்களுக்கு வந்து லோ பிபி இருக்குது. அந்த பிபியை வந்து நியூட்ரலைஸ் பண்ணி நார்மலாக எல்லாருக்கும் உள்ள மாதிரி உங்களுக்கு 90-60 தான் இருக்குது. இப்போ 120-80 வரைக்கும் நம்ம ரைஸ் பண்ண போகிறோம். இது வந்து ஒரு கம்பைன் தெரப்பி. வித்தவுட் மெடிசன் நம்மளால் மேக்ஸிமம் நிறைய டிசீஸ் வந்து க்யூர் பண்ணுறதுக்கு ஒரு வாய்ப்பு இருக்குது. இதில் வந்து சர்வைக்கல் ஸ்பான்லசிஸ், அப்புறம் வந்து ஸ்பைனல் கார்ட் ப்ராப்ளம், அது மாதிரி சர்ஜரி பண்ணியே ஆகணும் அப்படின்றதுக்கு முன்னாடி இதை ட்ரை பண்ணிவிட்டு இதில் முடியலன்னா அப்புறம் ஃபர்தர் ஸ்டெப் போய்க்கலாம். அதுக்கு முன்னாடி வந்து இதில் ட்ரை பண்ணோம்னா டோட்டலாக ரிகவரி வந்து ஈஸியாக கிடைக்கும். இமிடியேட்டாக இதை வந்து உடனே நம்ம செய்தோம்னா டெஃபினட்டாக ரிசல்ட் உடனே கிடைச்சிடும். இது எனர்ஜி லெவல் ட்ரீட்மெண்ட். உங்களுக்கு ப்ரீத்திங் ஃப்ரீயாக தாம்மா?
So this combines in.
It's a combined
It's
therapy.
being recorded,
This is
Amma.
not only that.
Yes.
It's a combined therapy. These are energy level. Our physical body is receive energy from the universe only. In Korea, it is called ki energy. In Japanese and Chinese, it is called Q energy. In our Tamil Nadu and India, it is called Brahma Shakti or Prana Shakti.
நீங்க அது அதர்வ வேதாலே.
இது வந்து நிறைய கம்பைன் தெரப்பியில் ஆக்சுவலாக நம்மளுடைய முனிவர்கள் வந்து நமக்கு என்னென்ன வாழ்வியல் வந்து அதர்வன வேதத்தில் மட்டும்தான் ஒரு மனிதன் இப்படி வாழணும், இப்படி வாழ்ந்தா இப்படி வரும் அப்படின்னு மருத்துவத்தினுடைய இதை ஃபுல்லாகவே அதில் இருக்கு. அதே மாதிரி கோவில்கள் எல்லாமே நாம் இப்படி வாழணும், பிரதர்ஷனங்கள், அடிப்பிரதர்ஷனங்கள், அங்க பிரதர்ஷனங்கள், இது எல்லாமே பாடி சிஸ்டத்தை கிளியர் பண்ணுறது. டெய்லி வந்து இந்த டாக்ஸின்ஸ் உடம்புலேருந்து ரிமூவ் ஆகிட்டாலே மெட்டபாலிக் டிஸ்டர்பன்ஸ் இல்லாமல் ஃப்ளூயிட் மெட்டபாலிசம், வாட்டர் மெட்டபாலிசம் வந்து சோக் ஆகும்போது தான் நமக்கு வந்து டிசீஸ் வரும். இப்போ கேஸ் அக்குமுலேஷன் இருந்தால் பிபி ஷூட் ஆகும். இப்போ ஃபினான்ஷியல் ப்ராப்ளம் ஒரு ஆளுக்கு இருக்குன்னா அவருக்கு என்ன மெடிசன் கொடுத்தாலும் அது கெட் டவுன். பணத்தை கொடுத்துட்டீங்கன்னா நார்மல். தட் இஸ் மென்டல் பாடி ட்ரீட்மெண்ட். திஸ் இஸ் ஃபிசிக்கல் பாடி. ஓகே ஓகே, உங்களோட வருகைக்கு ரொம்ப நன்றி.